Now we'll be discussing a very interesting ECG, and in fact this is a very common ECG. So you can simply try to understand, try to focus, and try to come to know what are the things which can be seen in this ECG. Now what we can see, one of the most important thing is, which is very obvious, is QRS. Now in this we can very easily see that the QRS duration is 138 milliseconds. So always see these things because we can directly come to know the values which are there. And it is very apparent that the QRS complexes, they are definitely very wide. We know the QRS must be less than 100 milliseconds. And 100 to 120, we say they are that the borderline wide, and more than 120 milliseconds, we call it as they are definitely wide QRS complexes. Now, why they are wide? Because the impulses normally from SA node to AV node, and then from AV node to ventricles, these impulses travel, and these travel from this pathway, and that is Purkinje fibers. So these Purkinje fibers are they are very fast fibers, and through which the impulses travel. That is the reason why they travel at a higher rate. That is the reason why QRS is very short or narrow. So the time taken is very short. That is the reason why they are very narrow. So whenever that time taken is more, the QRS will be wide. So why there will be a widening of the QRS? Because these Purkinje fibers are very commonly damaged because of the MI, because of the myocardial infarction, because of the ischemic heart disease. So that is the reason why these Purkinje fibers cannot transmit these impulses at a very good rate. That is the reason why it takes more time. That is the reason why the QRS is wide. So this is one of the sign that whenever the QRS is wide, we should always think of the ischemic heart disease. Now, second thing, we know that there is a normal QRS progression, that is from V1 to V6. What is that normal QRS progression? We know that V1 is placed on the right side of the sternum at around the fourth nipple. V2 is placed around left side around the left nipple. So V1 to V2, V1 and V2, we know that it is actually a S dominance. So QRS R wave will be very short. So if we see, V1 and V2 should be like a very small R, and mainly it should be S. V2 just like same, very small R but a long S. In V3, V4 we call it as an equalization phase. So R should be as equal as S in V3 and V4. This is called as an equalization phase. And in V5, V6, it should be mainly R dominant and very small s. So this R means ventricle. So this R means ventricular mass. So whenever there is good ventricular mass, we should get a good R wave. So if you are not getting a good R wave, it means that ventricular mass is damaged, is injured. So this is a normal progression of R wave. What we can see here is in V1, V2, it is all S, there is no R. In V4 and V5 as well, there is no R wave. It should be an equalization phase. This should be an equalization phase, but there is no R wave. There is only all S wave only. There is all S wave only. And in V5, V6, we have very small R waves. As we have this much of large S, we should have a large R in V5, V6, but it's not there. It means R is there because of the ventricular contraction, ventricular muscle mass. So R is not there, means ventricular muscle mass is not there, means the contractility is not there. It means it is significantly damaged because of the ischemic heart disease. So this poor R progression tells us that there is a high possibility of the patient having ischemic heart disease. Maybe the patient had an extensive anterior wall MI, lateral wall MI. So we can expect the ischemic heart disease or MI must have damaged the myocardium at least by 25 to 30%. That is the reason why we can expect this patient to have an ejection fraction of around 30%, which was in this case. This patient had an EF of 25 to 30% only. So this ECG tells us about a very beautiful findings, which are presence of wide QRS and presence of a very poor R progression, presence of large S waves in entire anterior leads can definitely significantly tells us about that the possibility of a very low EF, presence of ischemic heart disease, and presence of critical triple vessel disease, or presence of main LMC blockade. This was all about this wonderful decision. Thanks for watching.